Hi, welcome to the Coaching Game. I'm Laurie Lawson, and tonight my guest is Alvin Dike. Alvin, how you doing?
I'm doing great. How are you, Laurie?
Good. I have to tell you that Alvin is my physical therapist, and he's been my physical therapist for a long time. And we were talking about, well, there's so many things going on with the mind and the body and all the connection there. So we decided this would probably make a really great show, because coaches have a tendency to get in their heads and think about, oh, this is the best question, and how can I move this along? But there's a whole body thing going on too, which I'm finding out since I'm in pain. So it definitely influences what you do. But first, I want you to tell us what all those letters are down at the bottom of the screen. It's like they're very impressive.
Those impressive fancy letters.
Yeah. What is all that?
So the PT just states that I'm a physical therapist, and the OCS basically is a specialization in physical therapy. You have to sit for a 6-hour exam. It's 200 questions, all in orthopedics.
Oh my goodness.
Yeah, so it basically just states that I'm an expert in the field of orthopedics and physical therapy.
Oh.
And the CSCS is a Certified Strength and Conditioning Specialist. It just states I know how to exercise using scientific principles to make people stronger and more resilient.
Okay. Are you done? Because every time I meet with Alvin, he's on his way to getting another license or another degree. Are you done, or
I think I'm done with certifications, but the education doesn't stop. I'll continue to further my education, but the certs, I think I'm done with.
That's interesting. Now, where do you get your updates? I mean, I know doctors have the medical journal. Where do you have?
Yeah, so there's some people I follow who I admire in the industry, and I always look to see what they have. Like, how did they get there? And I'll just kind of look them up and see if they're from reputable, legitimate sources, and I'll make the decision whether or not I want to pursue it.
Okay. And is there like is there an update, or is there training and stuff where people go to get updated? Because I know since I first met you, which is many years ago, there's been you have a whole bunch of different equipment now, and it's a bigger place and everything. So
I subscribe to certain journals. I'm constantly reading and seeing how the field is changing, and it's just advantageous so I can bring it to the clinic and bring it to my patients to help them get better. You always have to stay with the times.
Cool.
Yeah.
So tell me something. What made you do physical therapy in the first place? Why were you born and said, "Oh, I want to do physical therapy"?
So
what made you decide?
Yeah, this dates back to I was like a kid. My parents always wanted us to go into the health field. But I knew I didn't want to become the traditional medical doctor. I value the one-on-one experience you get with patients, obviously now, just kind of developing relationships with people. And I also love exercise and value conservative management and physical therapy, which is right up my alley.
Yeah. Tell me a little bit about because we all talk about it, the mind, body, spirit. It's like that. It's so important to get them all three in alignment. But tell me a little bit about that connection, because I know that you deal with all of that.
I do. It's huge in physical therapy when people are in pain, because if you have negative thoughts and beliefs, it will biologically influence how you feel. So the first thing I do with people, I don't lie to them, and I let them know that there is hope, that you can get better, and you just have to switch your mind state. Because there's a lot of times where, people don't have anything anatomically wrong with them, but they have pain. And it's showing that the research is showing that a lot of it is coming from your mind, anxiety and stress. And so if you can keep that at bay while you're doing the things to help yourself physically, it leads to a positive outcome.
Here's a weird question. Can you have pain if your mind doesn't cooperate? If your mind doesn't send the nerve, can you have pain?
Yeah, for sure. Sure. Yeah, sometimes I deal with patients in which they treat pain with antidepressants, and they have MRIs, and nothing is shown in the MRI. They have a clean spine, and a lot of times where they have not so clean of a spine and have no pain, right? So I always tell people they're not their MRI, and pain is more complex than what we see on imaging, and and try to encourage just hopeful, mindful thinking.
Yeah, that's interesting, because I can attest that when you're not feeling totally in sync, and it really affects what you do and what you think and how much you can get done. I find myself limiting what I'm doing, and I'm going on, and then I'm not getting happy, and it's a cycle.
It's a cycle. Yeah, I always tell people, try to continue to do the things that you love. At least you're happy while you're healing, because if you take those things away, then it just makes things that much more worse. Yeah.
I said, because I remember I told you, and I said, well, the motion, the lotion is in the motion. It's like, just keep moving, just keep moving. And I tried to wimp out today and take the elevator up, but it didn't work. So we had to climb up the stairs. It's like, all right. So I'm pleased that I did that, and I appreciate you not going, go faster.
No. I took my PT half today. Take it off today. Yeah.
Good. Okay. So you decided that long ago you wanted the one-on-one experience. So what is happening in the world of physical therapy today? Has it changed? How long have you been a physical therapist?
I've been a physical therapist for about 7 years.
Okay. And so has it changed a lot since?
Yeah, it's changed. It's changed a lot in the sense that there's a lot of evidence being, done to help us become more effective in treating patients. And when I first started, I knew very little about exercise and like the principle of overload, and which all that means is just stressing the body in a way that it's not used to, so that it can adapt to that stimulus, and it makes people stronger. So when I first started, I think, at least maybe it was the practice or just where the field was going, to PT school, they stress a lot on manual therapy, on essentially putting your hands on patients. And it's taxing on your body and the body as the physical therapist. And also, we're finding that it doesn't work as well as exercise. And it also, the patient will develop a dependence on your hands, and that's not the point of physical therapy. Is to we're catalysts in improving your health. If you can teach the patient how to move and just kind of be accountable of their recovery, it leads to greater results and longer lasting results.
So my thought was always, and it's funny because I have a couple of friends who are in physical therapy. I don't know if that speaks to my age or my friends, but whatever. And they're very upset because it's like, well, my physical therapist wants me to go home and do these exercises. But I said, I always thought that was the point. I'm going so you can tell me what I need to do to get stronger. I always thought that was it. It's like, believe me, I love the massages and all that, but I know that I've got to do some work.
Yeah, you have to. I think a good PT model will give you exercises that will supplement the work that's being done in clinic. I like to give people exercises that are easy, doesn't take a long time to do, because it increases compliance. I think that when you're in the clinic, we're doing the skillful, more complex things that require my feedback, maybe my touch during the exercise. Right. But at home, you definitely have to do some work on your own.
Is it a lifetime thing?
I like to, that's how I like to put it, and I always phrase it as like, it's not a bad thing,
It's a good thing.
Yeah, it's a good thing. We're trying to encourage you to exercise, and I always, bring up the points, the benefits of exercise, and I always say it's better than having to take a pill every day, and hey, I'm not
a cane or any of that stuff.
I always say I'm not a surgeon. It's PT. You're gonna have fun and get strong at the same time. So I just try to make it an enjoyable experience, and and just try to instill a lifestyle change in the people I encounter with.
Well, now, every time I've been with you, it's been because I've been in severe pain and someone recommends physical therapy, and I just come to you. How can you tell when your body is not in alignment? What are some of the telltale signs so that you don't have to wait till you get into severe pain?
So I think it's more so like maybe for your general population, maybe you're not doing things with ease as you normally were, right? Or if you have to take 2 flights of stairs to get to your apartment and you're starting to feel it on the first flight, and maybe you're getting weaker, right? Or you have aches and pains, or just an ache, we don't call it a pain, when you sit for maybe 10 minutes. Oh, that's not normal because you were able to sit for longer maybe last month. So I think, that's a time where you would want to get assessed and have either medical professional or a trainer just assess you and kind of give you things to work on.
It's interesting because I know when I was looking, my general doctor referred me to a physiatrist, which is a pain specialist. But then we were getting into the guys who work on your bones or do the surgery. I don't even know what it's called.
The
And you go, no, not yet. We're not ready yet. That's an intermediate. Physical therapy is an intermediate step, right?
Yeah. I always, recommend that people get assessed by, clinicians that will give you a conservative route first. Generally, surgeons are great. We obviously need them, but sometimes when you refer to a surgeon and you're not a surgical candidate, they refer you anyway. So I try to, have people skip that step, either go to a physiatrist or get physical therapy first, because we're trained to make that differential diagnosis and refer if we think it's a bigger issue than than what we can handle.
So it sounds like what the natural step is like pain or awareness or something's not right, physical therapy, and then it's nice to know that these guys are out there, but we're not talking surgery or medication yet. That we're hoping to prevent that, right?
Movement is medicine. So that's what I try to preach. Okay. And just overall, just wellness. Don't wait until you are, feeling discomfort or pain. You should be moving anyway, right? I think that's where everything is trending, even just the general population, just fitness. Everybody wants to be fit. That's a booming market right now.
It is, and I think more so because I know when I travel and I go anywhere where you need a car, people don't walk. It's like, and if you walk, they try to pick you up. It's like, do you need a ride? It's like, no, I'm trying to walk.
I'm trying to walk. It's an exercise.
But in New York City, boy, you have to be on top of your game. There's subway stairs. I avoided the subway for a while, and finally I said, okay, you got to get back on the subway, and you got to get these stairs going.
Yeah, I didn't realize how many stairs there are in the subway until I personally had an injury.
Exactly.
Like, my God. I feel bad for my patients. Like, they have to go through all these steps to come.
And that's the problem with not being in alignment, because like you said, you do stop doing things that you normally would do. It's like, well, where's the escalator, or maybe I'll take a bus,
So you do things that I guess they just compensate for your injury, and then before you know it, you're just stuck in that hole.
So I don't know. So mostly you get referrals from medical people. Is that right?
Well, to be honest, me personally, I get a lot of people via word of mouth.
Okay, good.
Yeah, a lot of
which got great reviews online, really.
Which I think speaks is more of a testament to my work ethic and and the results I have. I kind of value that over having some type of contract agreement with a doctor.
The collaboration.
This guy's going to help you out. Go see him. And of course, reviews and whatnot. And I'm trying to shift away from that whole pain model. And I've recently been having people come to me just because they want to get stronger and they want to improve their health, which I really love and value. So
you're shifting. You'd like to shift away from
No. Just in addition to helping people. Yeah, of course. Now I never want to stop helping people who are in pain. But
thank you.
Yeah.
From a personal viewpoint. Thank you.
No, I never want to do that. I never want to do that. But I also want to, I can help that individual who is sedentary, because they may not be in pain, but they could be suffering from depression, and I know how exercise can help with that, right?
Interesting.
So when people move, they're happy, they like their physical therapist, they like their trainer, their mood, their overall well-being is better, and that's value, I really cherish that.
Yeah, definitely. And like I said, you do have great reviews, so I'm sure word of mouth is good. Well, you mentioned trends. What trends do you see? People want to be more physically fit, and especially Americans. It's like we're really obsessed. It's funny, my favorite saying is, Americans are the only people who think that death is an option. It's like, if I just run this other mile, it'll never happen to me. But so what trends are you seeing in the field, and where do you see it going?
Well, we're trying to make a push for, again, wellness, more preventative, and not viewing physical therapy as a place you only go to when you're hurt.
When you're in pain,
So that's, I think, the big shift that we're doing. You're seeing a lot of physical therapists who are crossing over I guess I'm one of them, like myself, who's
Okay.
crossing over that thin line between, oh, is that a personal trainer or is that a physical therapist? You know, so more so wellness. You know, I think that's where we're shifting to and expanding to, and not just dealing with people with pain. Yeah.
I like that. Speak to me about, and it seems obvious to me, but
Yeah.
speak to me about the difference between a personal trainer or a person in the gym and you.
Well,
And just do it. He hates to brag. Just say it.
well, like the amount of schooling that goes behind
Yeah.
being a physical therapist. We are doctors of physical therapy, which means that we went through undergrad, so we have a bachelor's and 3 years of PT school.
Right.
Yeah. So.
Yeah.
That's 7 years total of education. We have an intense medical background. We're able to interpret MRIs. We know about pathology. We know how to exercise with people who are in pain. And there's some great trainers out there who also know how to work with people in pain. But generally speaking, if you have pain, it's not appropriate to be seeing a personal trainer for that. You know,
Right.
Usually I kind of work with, trainers, and maybe they have someone who they're working with, and I will see that patient in physical therapy and also have them still go into personal training, but within, certain, restrictions.
Right.
So that we don't exacerbate their injury.
Yeah, because I don't want for people to think that we're saying, go out and get a personal trainer or go out and join a gym, because I'm always hesitant in the gym when they say, oh, do this, and it's like, well, how do you know what I need to do?
Yeah,
It's like, wait
that's
a
the big
minute.
concern. It's like, you should always just vet your professional, either your personal
Yeah,
trainer or your
yeah.
physical therapist, to see there's some reputable certifications out there, and if you join a gym that is kind of holds their trainers to high standards, you generally should be okay, and they know when to refer out or not, because ultimately it hurts their business if they get hurt in the gym.
Well, that's good. That's a saving point. Or find somebody with all those letters under their name.
that works too.
That's very impressive. The more letters, the better. So if you had to give us the folks tips about, what would you say? What's the biggest challenge that a physical therapist has?
The biggest challenge that a physical therapist has is just like the insurance-based model, right? Trying to adhere to all these just requirements that
Gets in the way.
Yeah, it gets in the
doesn't it?
way of just taking care of the patient.
Yeah.
It's ridiculous. Sometimes I hear, I'll get on the phone with a peer review, and the person on the other side of the phone is telling me that, oh, it doesn't matter if that person can't enjoy or partake in the activity that they like, because
we only approve 10 sessions.
Or we only approve 10 sessions, or their insurance doesn't cover that.
Yeah.
And it kills me.
Yeah.
Or someone on the other side of the phone is telling me that this person cannot get better and they should have surgery.
Yeah.
Doesn't make any sense.
Let's give it a try first before we go down that road. Yeah.
It's a backwards way of
So
thinking.
it's kind of I don't want to say fighting, because I know you're very collaborative with the medical profession, but it's kind of like fighting all the requirements and the. Yeah, I think everybody's coming up against that. It's like, will my insurance cover it? And if not, well,
yeah, so we lose a lot of people who need help, who just can't afford physical therapy. Or like, oh, yeah, my insurance doesn't cover it. I can't do this. I
or
can't
I'm
do
out
that.
of network,
I'm out
whatever
of network.
that means.
Yeah.
So.
Yeah, so I think that's just the insurance-based model is kind of like a big limiting factor.
But the great thing is, insurance does cover physical therapy as opposed to a personal trainer usually. So
exactly.
I mean, it's a give and take, give and take. But yeah, as long as there are good guys out there fighting to go, you know what, really, this person could use more. So yeah.
Yeah, and that's what we'll occasionally have to do: get on there and just argue the person down, and sometimes it works, sometimes it doesn't.
Yeah. If you had to suggest, what are a couple things that people could do in lieu of physical therapist, or what would be a tip for people to optimize? I like what you said about. I think you said something about stretching the capabilities, going up here so you can strengthen yourself, and eventually that will become the norm. But what else could people do to get themselves in as good a shape as possible without you.
Without me. I always tell people to just engage in some type of cardiovascular exercise at the very least, whether it's just walking or climbing stairs or just going out for a walk, just at 30 minutes a day to start,
Just to increase the physical activity.
To increase your physical, like walk more, instead of taking the bus, maybe you walk 10 blocks, then you hop on the bus. Or if, you walk the first 3 flights of stairs, then you take the elevator the rest if you live on the 6th floor. Just trying to be active, and limit the amount of time you sit during the day, stand, do things that are just generally just active. If you're passive for most of the day, that's not a good thing.
No, and unfortunately with all the computers and everything where people don't have to move, I'm sure you're seeing a lot of that.
Yeah, we do see a lot of it. It's just encouraging people to take breaks, to stretch. Nutrition, of course, is big, but just moving often and moving well is what I try to preach.
Okay, and so are there age limits? I mean, do you take that into consideration? I hope you do. No,
the age limits, no.
That's why I end up dead after each session.
There is no, not at all.
That's why I go home when I'm going so tired.
I am not. My oldest patient, I think right now, is 93.
Oh my gosh, really?
And I have him squatting, I have him split squatting and step ups.
So there really isn't, okay, well
it's all relative, and you just have the good trainer, a good physical therapist will just match that person's intensity.
Right.
Yeah, and that's the key, right? So it's all relative, and just knowing how to identify that is a skill. But everyone should be doing it. I have them doing push-ups, I have them doing everything, pushing, pulling. But it's all relative to him.
That's funny because your assistant, or he's interning someone, Dominic, and he goes, you should walk 3 flights of stairs. I go, I never walk 3 flights of stairs, but are you telling me I'm going to be able to now? It's like, no. But
he has the bug now. Trying to, that's another thing, trying to shift the culture with the students, the interns that we have. It's just, teaching them the right way so that they can take that forward and, influence others as well.
Are the schools doing a good job of that? Or?
The schools are doing a really good job at identifying strong students, and of course the practical experience that they experience with in the clinic is what really counts. But the schools are.
Okay. Well, what about the other end of the spectrum? Is there anything too young? Is it too young to start this?
Well, I mean, no, I would say no. You don't want with the kid. You just don't want them to specialize in one particular modality at an early age, right? You only play soccer, you only play. But I think with kids, you just want them to play. There's exercise in the form of play. And then as they get older,
that doesn't mean games on the computer.
No, exactly. Like going to the park and
walking
outside or playing tag with friends, and that's exercise, And then they can do some type of recreational sport if that's what you want. But encouraging your kids to go to the playground, riding bikes with them, that's important. And that starts as early as when they can walk or crawl. It's being active.
Okay. All right, so you're not too young,
no,
you're not too
old.
old. Just keep it moving. Keep it moving. Well, speaking of moving, where do you see the future of physical therapy? Or where would you like to see the future of physical therapy?
I would like to see the future of physical therapy, like with all physical therapists understanding that their patients have to exercise. I feel like depending on what clinic you go to, treatments are too passive, and people aren't getting better. If you choose that approach, it just develops a dependency. And in my opinion, they will come back because they want more massages. But is that really ethical? Or are you really doing your job as a PT, right? I think that's a question we have to ask ourselves as physical therapists generally. So I hope that the profession kind of shifts towards a more active kind of treatment approach. As opposed to the passive stuff that I see being pushed, because it pays,
Was the passive, would that be like the massages?
The
and
massage, the modalities, the electric stimulation, when you see everybody knows the E-step.
I've had that before.
You get the classic question, hey, Alvin, are you going to put the electric stimulation? No.
No. I'm not going to do that.
Don't get me wrong, I do use it because it helps in short time. If someone's in a lot of pain, I will conclude a session with it, but Very rarely. You know, if the person has no, preconceived notion on, physical therapy, they're going to get a more active approach.
Okay.
For sure.
Yeah.
Yeah.
All right. So that's the ideal, huh?
Mm-hmm.
So it's like we don't have that much time left. What else do we need to know about physical therapy?
Physical therapy should be fun. It should be
Okay.
challenging.
Yeah.
You know, if you feel like, for those of you who are viewing, feel like you're not getting, better within your current physical therapy situation, I think instead of just leaving, have that conversation with your therapist, because maybe you guys can switch up the approach. But PT should be fun. PT should be challenging, and you should see some progress. And not saying that PT can fix everything, but you should see changes within a certain couple of visits, or trending towards being better, whether it's emotionally or physically. Like you should be getting something out of that. Yeah.
Well, and I would also say that I find one of the benefits is that eventually it's in your hands, and it's like, so I don't have to keep, not that I don't like seeing you, but I don't have to keep trudging over and doing it. So eventually, I think it hands you back your freedom almost, or your mobility, or whatever the case is, a reason why you went there. I think it hands you back that sense of well-being, and it's like, oh, I'm in control again.
You should feel hopeful.
Yeah. Oh, I like that.
You should, day one, you should feel hopeful. Like, this guy's gonna help me be better.
This is gonna work.
It's gonna work. Yeah.
This is gonna work,
and
I'm gonna help.
Yeah.
I'm gonna be a
and
part
you're
of
gonna be
it.
a part of it. Exactly.
Yeah.
Being a part of it. It's just don't rely solely on your PT, but like I said, it should serve as a catalyst. Yeah, just to help you get better.
Yeah, and I think it, and as definitely as an intermediate step, so that you don't go straight from pain to pills and then to surgery. I think as an intermediate, it's like, well, let's see if we can avoid all that and do our thing. But so I'm sold, and it's not that. Well, yes, let me not say it's not fun, but it's challenging. We'll say it's challenging. It's challenging.
She has fun.
Yeah. Well, yes, you have a great place where you're doing it. So, definitely. So I don't know. I would say keep doing what you're doing. And are you said you're finished with where you want to go, or?
Well,
is there
no.
something?
More so is just trying to.
I knew he wasn't, because he never stops.
I'm done with all the certifications. The certifications just kind of helps me, opens up certain doors. But no, the knowledge and the continuing education is probably not going to stop. I can't.
And challenging yourself.
And challenging
also.
myself. I treat it like a sport. Get better. Keep getting better, because your patients will benefit from it. Yeah.
Definitely. So if we go to look on the bottom, you'll find him on Instagram. I understand nothing about that, but you'll find Dr. Alvin Dike on Instagram. I want to thank you for being such a great guest and coming in, and I'll see you on Tuesday.
Yes. Wow,